In my years spent treating the pain syndromes of baseball players, I've become keenly aware of their asymmetries and mobility needs. The upcoming routine was created with them in mind. My goal was to provide a routine that was time conscious and did not require any ancillary equipment. I know that if you make time to perform this routine with your players, you will cut down on injury risk and create a more durable baseball player. Movement 1 here is the open book with the arms at what I call 90-90, so 90 degrees of elbow flexion and at 90 degrees of shoulder flexion or abduction. I'm lying on my right side. It's important to keep that bottom leg completely straight, and then I'm trying to bring that top leg up and bend the hip and the knee to at least 90 degrees. I would love if that knee was over hip height, which in this picture I'm just over hip height. Second maneuver is still an open book, but I'm calling it with scapular rotation. Okay, both are great at getting and maintaining spinal mobility through the cervical as you follow that hand with your head and your eyes, and as you turn and twist your thoracic spine all the way down through your lumbar spine. You can notice my knee pops up a little bit. You really want to encourage your athletes to keep that knee down to get as much rotation as they can for that. We really like for our pitchers in general to be able to do shoulder-hip disassociation. This next one is a soft tissue mobility. You can see I put that ball right on the back side of my throwing arm. It's in my rotator cuff region. And then I lie down on top of that ball. I'm trying to find tender spots. And while I'm pressing into that ball, I'm moving my shoulder through a flexion movement pattern. Again, I can't stress enough, trying to find tender spots. There are some places that will feel okay and other places that won't feel great at all. I'm encouraging you to tell your players to find those spots that are really tender and to key in on those. Don't avoid those. The second maneuver, the same kind of thing. That ball is pushing on the rotator cuff on the back side of the shoulder, and then you're simply taking it through external rotation right there and internal rotation right there. Maybe 5 to 10 repetitions, and you can see my grimacing there. That's because it can be tender, but it's great to release some adhesions in that rotator cuff and to keep that tissue moving well. All right, what you can't see here is my hands laced behind my head here. All right, this is a single high kneeling rotation maneuver. That front knee should encourage your athletes to keep that knee pointing straight ahead, and I'm trying to turn my shoulders and my spine towards that high knee. We're going to do this on both sides. Here I am. I'm twisting to the right. My arms are up behind my head, laced together, trying to keep that front knee, that high knee, pointing straight ahead, so that again we get this hip-shoulder disassociation, which promotes good spinal mobility. Okay, similar setup here. I call this the needle thread stretch. That leg going out there, really important to keep that knee pointing straight out in that direction, okay? And then turning and twisting through the thoracic and lumbar spines. Again, you see how my head follows that hand, okay? This will be a challenge for a lot of your athletes. The biggest point of correction on this is just to make sure that when you set up that leg, that knee pointing out to the side there, you encourage them to keep that hip opened up and have that knee pointing straight out. Again, following that hand with the head and the eyes is going to promote really good hip-shoulder disassociation, good spinal mobility. This is a really, really good one for pitchers in particular. Okay, transitioning to this sprinter's stretch. There aren't many adolescent baseball players who have great hamstring length, and this is something that will encourage some hamstring lengthening, okay? If they can get their knees straight, that's great. I just haven't met a whole lot of adolescent baseball players who can get those knees straight. And you see I do it in a staggered stance with my right foot forward first, and now I'm going to do it in a staggered stance with my left foot forward. Now I'm going through 5 repetitions on both sides, trying to keep those fingertips down on the ground, because that's what's going to keep you honest, and that's what's going to really challenge the length of the hamstrings. This last one here is a tough one, hits a lot of different regions. I love this closed chain position for the hands, elbows, wrist, hands, and shoulders. This is called the inchworm, all right? And they're trying to walk up with their tiptoes, pike up, drive those heels to the ground, and really challenge the hamstring length there. That nobody likes that one, but it's great